Back to the Sports Medicine Live at NATA 2018. We are podcasting live from the Dragonfly Max sponsored podcast lounge. I got my boy Robbie from Frio Hydration chilling, making faces at us, doing some Snapchat with the Snapchat filter. And of course, we got Hoist Water again. Casey Lunt here from Preventative Health
Lifesavers Preventative Health Screeners.
Lifesaver. I knew I missed it. Lifesaver Preventative Health Screeners. So he's got drinking him some Hoist Water here to help stay hydrated. He's talking to all these people at the conference there. So, Casey, you guys are in the ultrasound business. You do ultrasounds to help prevent like sudden cardiac disease or to identify those and to do preventative medicine, correct?
Yes, sir.
All right, so tell me a little bit more about the process, the company.
So the name is Lifesavers Preventative Health Screenings, and that's what we do is we bring life-saving ultrasound to the campuses, to the facilities. We have registered diagnostic medical sonographers who perform the exams, and then we followed up, and those are read by either board-certified cardiologists or vascular surgeons, depending on which tests are performed.
All right, so I'm not an expert in that or the other thing. I know that there was a company like Wimbledon, something like that, and they did something similar. Was it ultrasounds or was that ECG stuff?
So I have heard whispers of their name here, and it sounds like they did go around the appropriate model in doing so. So we are 100% not associated with them. We're our own entity. All my staff's been doing ultrasound for 20 plus years in each of their specialties. As myself as well, I've been doing it for 15 plus and travel the world doing ultrasound. But we do diagnostic ultrasounds, but it's in a screening process.
All right, so tell me a little bit more about that, because I'm an athletic trainer.
Right.
I don't do ultrasound. So.
Yes, sir. So I actually came out. I went to college. I was an athletic trainer myself, Oklahoma State, and then I went back and became a diagnostic medical sonographer. So you work in hospitals and you examine the patients and we diagnose, but you only diagnose to the physician, but you're not diagnosing to the patient. So we diagnose to the radiologist or the cardiologist or the vascular. They read it and check you off. Sorry. Yeah. Yes, sir. Very well.
All right, so you're saying you guys come out to the schools and you're doing this now. Right now, we have an option when we're doing our athletic physicals for kids to get the ECG done as part of their physical. They could pay the little extra fee. What does that look like for you guys?
So EKG is a precursor, and that is used in the current model today in the U.S. sports model. Is you usually get your athletic sports physical, and sometimes that'll lead to an EKG or ECG. Kind of what my mission, what my passion is to bring ultrasounds to everybody, because unfortunately those ECGs, they can catch particular cardiac anomalies, but they don't catch them all, and they catch probably very few, but the ones that cause sudden cardiac death, where we lose athletes on the field or the court, those are preventable, and we can find them with diagnostic ultrasound tool that we utilize with our sonographers. And so EKGs are in there, and they can look at it, but the major anomalies that take place, they don't show up on an EKG, unfortunately.
So logistically speaking, you're saying you're going to the high schools. So what does that look like? So you come in, you take a whole day, and you can do 10,000 students, or it takes 30 minutes per student. If you need one quiet room for each person. So logistically, what does that look like?
So we do go to colleges, high schools, private schools, private sessions, whatever it may be. If we are going, and we either try to set it up during their sports physicals, but so on some of these programs, for example, where I live in Dallas, we had one of the ISDs that we were working with. They had under his helmet, he had 9,500 student athletes, and so how are we going to scan that? So everybody thinks that we need to get it done during, like, right before practice or before the season starts, but in reality, what we do is we start scanning the seniors, and we work our way back all the way to 7th grade. And once we get through all of them, it's just each year with the new ones that come through that are starting sports, we scan all of them. So it's kind of a process where I have multiple sonographers and multiple machines when we get to those particular accounts that have greater demand.
All right, so 9,500 kids in Dallas ISD or Dallas ISD? Plano ISD. How long did that take you to do 9,500 kids?
So we're still in process, put it that way. To your original question, sonographer, when we come in and he does that particular exam or she does that, it's probably from them laying on the table to getting off the table should be 15 to 20. So probably we block 30-minute windows and we just start them at 8 and we run through them all day, depending on the number, because you're not always doing all the same sports at the same time. So we can run through basketball pretty quick, or we can run through soccer, football teams. It's a little bit more involved, but depending on the numbers, we bring the appropriate numbers to address the volume.
All right, so I mentioned Wimbledon or whatever it was,
right,
and you mentioned the incorrect model. And so what I knew of them,
right,
again, not you guys, what I knew of them was that they would come and then they said it was free to the athletes, but they would file on the athletes' insurance, and as long as the majority of them were on like Medicaid or Medicare or something like that, then it was free, or the ones that didn't, there was like a reduced cost or something like that. So again, just the logistics of how this would work in a high school setting. You said it's about 30 minutes per athlete, and depending on the size, depends on how many sonographers and machines you bring, and you can do it multiple dates, or you can do it at the same time in conjunction with the physical. But as far as like the pricing structure, how does that work?
So one thing I have taken out of that I would prefer not to involve in the company is insurance. So the insurance referrals or doctor referrals. So we don't, because with that insurance, it comes too much red tape and bureaucracy that doesn't need to happen. When we just want to get the kids scanned, we're there to save their lives and we're there to look at them. So we make it feasible to most, I would say, a pretty large, significant portion of the population. We keep it in a valuable range, probably no less between like $150 up to $300, depending on per athlete. But typically we keep it in a pretty good range to where everybody can get screened or scanned without having a significant cost, implication. So we do that. We screen it. It's a cash pay. Sometimes parents coming through sometimes it's a parent PTA, sometimes it's foundation, sometimes there is public and private schools that just write the checks, but the ISPs, it's a little bit longer process.
All right, so you come in, you scan me today, 8 in the morning. When do I find out the pertinent information about my scan?
So the clinicians, they'll be doing the exams. They know immediately exactly what happens. They know, but officially what they'll do is they have to then, if we're doing a heart scan on you for cardiology, so then we'll have our cardiologists read over the scans. And then once that, I think what we have right now, I think we say within 2 weeks, we'll get those results back to you. But we say up to 2 weeks. In reality, we probably should have them. If we're doing that whole school, we'll have them by the end of that day. I mean, we'll have them within that time period that we're there, because we either have them on site or accessible where we're doing it while we're on the fly. So, but under 2 weeks.
All right. So, what are we looking for specifically when we're doing an ultrasound?
So, the focus and the biggest silent killer, and what we're here for to save these students' lives, is the biggest killer is sudden cardiac death, which is caused by multiple cardiac anomalies that are from genetics, they're born that way. The biggest number one killer is an HCM, hypertrophic cardiomyopathy, thickening of the heart wall. Basically, is what happens. It just gets so thick that it can't bounce, it can't beat anymore. But where we kind of differentiate ourselves in this particular region is we can find that, we look for that, but my guys are trained we look for the coronary arteries that are coming off the heart, and those are the kind of the silent killers. Those will be missed by a general sonographer typically, because they're not trained to look for those unless they're specifically doing cardiac testing. So a lot of my team from the cardiac side, they are looking for, this is where the coronaries, they should go this way, but they go this way. And with exertion, with a lot of exercise and the blood flow going, they compress the other arteries and collapse, and the heart stops. It's the end result, unfortunately.
Okay, so you said the arteries can be crossed?
Yeah.
The coronary arteries can be crossed?
It's more about where they come off of the heart. They should come off the aorta, but it's about where they come off, like where their origin is. Sometimes they're born where the origin. It's fine for everyday operation, but when they get to a point of exertion that's past their normal limits, it will collapse upon them. So there's about 5 or 6 different anomalies that our team can find and evaluate that aren't typically evaluated.
All right. So if there was a population who is most at risk, or the population that it most needs your service, what would you say that is?
I mean, statistically, if it's purely in the athletic world, basketball players are they're the most common because of their build, because of their height and their tall. But it's pretty prevalent in the football realm. It kind of spans all. I would say the overall HCM, hypertrophic cardiomyopathy, its statistic is 1 in 500 humans. So out of every 500 people, somebody has one. So it just kind of depends on the statistics and numbers and where you're at with your schools and population. But it's about 1 in 250 student athletes experience some cardiac malformations throughout their lifetimes. Yeah.
All right, so tell me a little bit more just about the company. How would we find out? How would we contact you? And then again, I'll go from there. So.
No problem. So yeah, so of course we have a booth here. What is our booth number?
It's okay. Just release much later.
Perfect. Yeah. So we have our booth number. We're here, all week. We do have, of course have our websites. We're on Facebook. We're on Twitter. We're on all the normal social media outlets. And I'm Casey, and then we have our direct emails and contact information that that we can be contacted through.
All right, so the website is lifesaverpreventativehealth.com.
It is.
All right, so now at this point, I say I'm in. I'm gonna do this for my kids. What do I do? What do I do next?
They email through our website. It's an email. You can set up an appointment, set up a consultation, call us, email us. And from that point, we set up a logistics and where it is and how many athletes, who it is, where we're going, and then we plan accordingly to, get the proper people in place.
All right. So one other question is, I'm a low socioeconomic school, poor parent support. I have issues if I say, hey, you need to take your kid to the doctor. Most of the time they don't, or even right. Some of the times that we're close enough to Mexico where I am, they'll say, okay, well, we're going to Mexico, right? So what does it look like? Do you guys have to have a certain number to come out? And then what does it look like if in an environment where you do have that socioeconomic status support, parent support?
So we've looked at a couple different venues in that aspect. So where I'm at in Dallas, in the north part, I'd say it's pretty affluent. So it's a pretty accepted model. However, in Dallas, there's also plenty of places that are non-affluent. And what we've looked at in how to serve those communities properly is foundations, grants. Even we talk about foundations here, ultrasound, some of the different companies that we've tried to partner with. So maybe we can still address, all athletes. So even if we come into a school and maybe, half the kids can afford it and the other ones can't. I've been in ultrasound in the medical industry for 17 years. I created the company, and it's called Lifesavers because that's truly what I want to do. So the finances is not my number one focus. So if we have kids that we need to take care of, we'll take care of them if they can't be done. So do we want to do the whole world? Of course. Do I still have to take care of my costs and pay for machines and get people there? Yes, but in the same terms, we're trying not to leave anybody out. Our motto is no athlete should go unscanned.
All right. So again, you said your desire is to save the lives. Do you were an athletic trainer, or do you have a story or an event that where you lost an athlete or had an athlete go down and that started this?
There is, I would say, my testimonial of what kind of put me down this road is after doing an athletic trainer and then I had ultrasound, and then I was blessed with the company to go commercial, and I basically got to go around the world, and I covered 65 countries. So I saw how the rest of the world does medicine and how the U.S. does medicine and the benefits and the advantages, and I lived in it, so I saw them. But my testimonial, so I saw how the rest of the world uses ultrasound first. In the U.S., we kind of would guess and throw every test possible at it, MR, X-ray, nuke med, or unless you have insurance or you have a reason, we won't scan it. And it's not the same there. If you want to go to the doctor in another country, you go and get seen. But my thing that stands out in my head is when I first got into ultrasound, it was like my first year after I left sports medicine. I was doing PT at Baylor, and somebody convinced me about ultrasound. And I was already done with the school, and I was working at Baylor, and this guy said, "You want to do some screenings with me for the surgeons on the weekend?" And I did. This guy came in. He was in his mid-50s. We were doing screening for carotid for stroke, aorta aneurysm, legs for blood clots. And I put on your aorta should be about 2 centimeters when we measure it. When I put it should start close to rupture between 4 and 5 centimeters. I put it down on this guy's aorta, and it was 9 by 9. And I was like, I was new, so I didn't really know if I was just not sure what I was doing. But then I went and got the surgeon. I'm like, it was 9 by 9. So yeah, if that guy coughed or grunted, he would have died. So we saved his life that day. But I've done that throughout. Our career. Ultrasound is a very unique modality that you can save lives by finding things early instead of late.
All right, so what other, besides NATA, what other conferences are you guys at? Does somebody could come by, see a booth, or kind of check out, maybe have a conversation with you guys?
Yeah, so I've been doing the commercial world for many years in the ultrasound space, where you have a lot of conferences of radiology, emergency doctors, vascular, so each specialty has their own. All my guys have experiences 20 plus years. We just started this last year, so this is kind of a test waters for us to see what type of atmosphere this is. But some of the stuff I've been looking at is with athletic directors, with coaches, and then also we're in our other major spaces, seniors, in the senior health space.
Right. So if somebody wants to find you, then they could just reach out by going to your website.
Lifesavershealthprevention.com.
And then if they wanted to, have you guys come out or meet up with your conference, you guys could kind of coordinate from that.
Absolutely. Yes, sir.
All right. Any other thoughts? Anything else that we didn't cover?
Yeah, no, Jeremy, I appreciate your time and letting me get in here, jump in here today with you guys. It's a great opportunity. I'm happy to be here. It's nice to kind of tie ultrasound, and especially following the gentleman I followed. I had some conversations with the board of directors up there today, where today a lot of the athletic trainers, they have a lot of tools and they could have an ultrasound, but they don't have the credentials to do that. So I would say I see a bigger picture. It would be nice to at one point maybe bring diagnostic sonography into the athletic training programs somehow and try to connect those two. So then those guys could have all tools at all times on the field. So yeah, we look at hearts, but you can diagnose an MCL, an ACL, a shoulder, a stroke, and a thoracic outlet syndrome on the field. We don't need to get in an ambulance and go to the ER and get an MRI. We can tell you in seconds and moments. So eventually it'd be nice to see ultrasound on every field, and the athletic trainers being able to put it in their hand and use it.
Very good. Yeah, I think that it's kind of coming around to like a new understanding of ultrasound. From what I understand from the doctor from, I think he was GE. He's part of the imaging thing.
Right.
And I was telling Keith that he had the pocket size ultrasound. And so that's pretty cool for me to see and hear, and just like, oh, ultrasound isn't just for pregnant women. Obviously I knew a bit more of that, but I really hadn't heard of it being used for injury type treatments. And so, Casey, I appreciate you coming out, and I'm glad to learn a little bit more from you. And again,
Lifesavershealthprevention.com.
Yes, sir.
If you want to reach out, you want to bring them to your school, if you want to just find out more about the pricing model, what it looks like in your school, then again, feel free to reach out, and then Casey or one of the team members there can get in touch with you and hopefully save a life.
Thanks, Jeremy. Pleasure. Thank you, sir.